What's up, everybody? Happy Tuesday. Getting locked and loaded today. Got a whole lot of value. November, very important month, and a lot of healthcare celebrations. And by celebration, of course, we're not necessarily celebrating. This is a call to action and an epidemic, and we'll be talking about it, guys. Cool. So, November, Diabetes Awareness Month, American Diabetes Month. We're going to talk about that today. If you guys are ready for this, we'll get diving in. So good evening, cherished viewers and trailblazers of change. I'm Dr. Joaquin Acosta, welcoming you back to the Know Your Pharmacist Livestream. Tonight, we rally in awareness, not in celebration, as November calls us to confront the diabetes epidemic, a challenge that unites us in purpose and resolve. As your guide, I'm here to connect our community with empowering knowledge and innovative care strategies. From the silent surge of pre-diabetes to the triumphs of modern pharmacy, we're diving deep. We'll explore how technology can be a beacon of hope and how alternative therapies like cannabis can chart new territories in wellness. Join us as we illuminate the path to better health with gratitude to our sponsors, Pharmtrue, Horse Cannabis Co, Vado Speedway Park, and the Baked Chicken Farm. Your unwavering support amplifies our mission to enlighten and inspire. Prepare, guys, to be captivated as we embark on this journey together, fostering collaboration, sharing expert insights, and nurturing the seeds of community wellness. Because here, every voice matters, every story inspires, and together, we're scripting a new narrative for health, one filled with hope, innovation, and the collective power of informed action. Let's get started. Wonder if anybody voted today. Hope you did. Otherwise, you got about an hour to do it. Las Cruces, everybody out there. Let's jump into Pharmacist Frontline. First segment of the day, guys, looking at how pharmacists play an essential role in the diabetes care team, and I hope that everybody is using them accordingly. And I will make sure that, we always continue to harp on things like this, because this is what I do best, right? So putting this out here for everybody. Just looking at the examples of what a pharmacist's role in diabetes management is, it's a really, really important topic here, because November, Diabetes Awareness Month, will jump into some shocking New Mexico statistics, guys. 587,000 people in New Mexico. That's 1/3 of the population, a little over 36.1% of the adult population who have pre-diabetes with blood glucose levels that are higher than normal, but not yet high enough to be diagnosed as diabetes. So what did we see? A lot of the, GLP-1 agonists, or even, Mounjaro, right? The twin cretin there, the big push for that, right? Whether it was Ozempic, Mounjaro, Victoza, even using it to drop those pounds, reduce that risk of pre-diabetes. New Mexico, we were fighting for it because, of course, right there, you've got, again, 36.1% of the population here in the state with pre-diabetes, and not everybody even knows that they have it, right, guys? How many new diagnoses are we going to have today in diabetes? How many are we going to have this year in diabetes, right? We're going to continue to flesh out some of the facts here. In New Mexico, we are, 12.3% in total in type 2 diabetes. We're not good. And, the best thing that we can do is educate, advocate, try to be here for one another. Please use your pharmacist to the full advantage, guys. So when you're looking at this, right, the most effective way to manage patients' diabetes, according to the American Diabetes Association, is with a team-based approach. That team may be most effective if it includes a pharmacist. So guys, right now, where some people really just get stuck going to urgent cares or some of these clinics that maybe they just feel in and out of, a pharmacist can be a really, really great bridge to some of that care to make sure that everything is on track for you, right? The American Diabetes Association has their clinical guidelines for type 2 diabetes management, and we're mainly talking about type 2 diabetes today, guys, but you really look at the medications you should be on, medication adherence, having the support, so on and so forth. You really look at the pharmacy team as a critical aspect for making sure that is a good outcomes for the best patients, right? And it means so much because it's gotten to the point that now insurances are grading pharmacies on their performance for how well they tailor to their type 2 diabetes population. We'll get into, right, the stats of the burden of cost for type 2 diabetes and what this really, really looks like on our country, on our citizens, and this, snowball effect, right, from our socioeconomic situation to everything else that has led to where we're at right now. How do we beat it? Recognizing it is a very, very powerful point in that. We're talking about that, guys. Diagnosing diabetes early can really save lives, as we're talking about when you're managing it with a pharmacist, a pharmacist as a part of your healthcare team, and you're really leaning into that. You can really take a look at where you sit in terms of your health outcomes. Is your A1C good? Is your weight coming down? Are you taking your medications on time? Are your medications covered by insurance? Right? What are the barriers you have to perhaps taking that medication? What are these little fine-tuned recommendations that pharmacists are going to be able to dial in on, because that's what we do best. And again, that's what I want patients to be able to take their time to talk to their pharmacist about. Make sure that you use your healthcare team together. Again, sometimes in the mix of it, as long as everything's smooth and you have a patient-provider relationship, maybe you don't engage with your pharmacist as much. But this is me out here saying, guys, we're still losing the overall war with type 2 diabetes right now. It's an epidemic, and early detection, saves lives. Guys, as we've been talking about in our Men's Health Minute, men don't go to the doctor unless you're absolutely sick. As we look at type 2 diabetes rates here, where could that perhaps play into effect with how we address, looking at these signs of type 2 diabetes early, the warning signs and symptoms? I have this right here pulled out from the diabetes.org website. They're doing great for American Diabetes Awareness Month, looking initially common symptoms of diabetes, as we, probably associate urinating often, feeling very thirsty, feeling very hungry even when you are eating, extreme fatigue, blurry vision, cuts and bruises that are slow to heal, weight loss even though you're eating more. That's type 1. That'll really, really be noticeable. Tingling, pain, or numbness in the hands and feet. Type 2 is a place where you can really recognize that. Guys, what are the risk factors for diabetes? How do you detect what your risk overall is going to be? Does your family have a familiar history of it? Have you seen it be managed before? So on and so forth. These are things that doctors dial in with you, but now, jumping into tech talk here, look at the type 2 diabetes risk test, guys. You can take a 60-second risk test here. I'm posting it here in the chat, so you have the link to it. Again, and even if you don't know all the answers to some of these questions, think about that. Just be humbled by the fact that, hey, maybe you should be talking to your doctor a little bit more about what's going on. So let's pretend, somebody else. Why does this matter? Less than 40 years old. What's your gender? Man. Do you have a mother, father, sister, or brother? No. Have you ever been diagnosed with high blood pressure? No. Physically active? Yes. Hispanic? I'm 5'9", about 200 some pounds. Oh man, it's exactly. Can I see my results online? Let's see. Boom. Low risk for now. But again, even as it tells you here, your risk for having type 2 diabetes is low. However, your risk changes over time. Again, what you really can know is your, hemoglobin A1C. Go over that with your doctor. Men, I'm 30 now. Men in your 30s, you need to be starting to get checked, right? You need to be getting that physical, taking a look at, things like blood pressure and diabetes, because this is where your metabolism starts to change a little bit, starts to not be, right, what you were in your 20s. You can't just wake up and be Jack, be nimble, Jack, be quick anymore. Maybe some of us can. But again, I want to make sure everybody has that test, that they can go through it, take a look at your risk. That's what we want to make sure we give you guys all the best value that we possibly can through this live stream, guys, because that's what it's about. You know, what is it? What does it mean to actually make a difference? If we could prevent one person from having severe complications from type 2 diabetes with this live stream, that's money right there. And not like physical money. I just mean great positive outcomes. And so let's look some of these shocking statistics and move and jump right over into our enlightenment hour. So the burden of diabetes in New Mexico, right? We're looking at diabetes as an epidemic in the United States, according to the Center for Disease Control and Prevention, aka the CDC. Over 34 million Americans have diabetes and face its devastating consequences, which is true nationwide is also true in New Mexico. So New Mexico's diabetes epidemic, approximately 200,548 people in New Mexico, or 12.3% of the adult population, have diagnosed diabetes. In New Mexico, diagnosed diabetes costs an estimated of $2 billion in our state each year. The serious complications of diabetes, including heart disease, stroke, amputation, end-stage kidney disease, blindness, and death. So not only, is the management of diabetes incredibly expensive, but if you don't do it well, the costs just inflate even more, right? When you're looking at hospital, perhaps readmissions or whatever other complications and surgeries and outcomes that could be coming from that, because we didn't manage something properly. And what didn't work, right? Maybe the healthcare office or provider feels like their system is perfectly in place to educate a patient or set them up for success, right? Well, what's falling through? Something's got to fall through somewhere, right? Patients got to be empowered to, take, advantage of the fact that your healthcare provider is trying to set you up for success, and try to learn and try to, be willing to participate. And where do you find that deep down, right? What does that mean for somebody to resonate with that? And we don't have those answers quite yet, but it's good questions to just really facilitate, especially as we look at, the holidays and where we're going to be. And, it's an interesting time because everybody's going to put on those holiday pounds and all things like that. But what if, right? You could maybe prevent a couple bad situations, and all of a sudden we can just be a little bit more empowered than the average bear, and all of a sudden be, maybe setting the example someday. You never know. Never know. So, right, if you look at 587,000 people in New Mexico, with 36.1% of the adult population who have pre-diabetes, with blood glucose levels higher than normal but not yet high enough to be diagnosed as diabetes, right? A little over 500,000 people in our state pre-diabetes, but again, it's not always recognized, and there's more diabetes being diagnosed every single day. So again, right now in the statistics about diabetes in the United States, let me just share a couple things here. So diagnosed and undiagnosed, of the 37.3 million adults with diabetes, 28.7 million were diagnosed with diabetes, and 8.5 million were undiagnosed. So as you look at that, guys, we are missing because people are not getting diagnosed by, avoiding the doctor or not being adherent or whatever that may be. And so all of a sudden, you're starting to look at the back end problems from there, aka cost burden, patient outcomes, so on and so forth, right? So moving back, diabetes to New Mexico, people with diabetes have medical expenses approximately 2.3 times higher than those who do not have diabetes. Total direct medical expenses for diagnosed diabetes in New Mexico were estimated at $1.5 billion in 2017. And in addition, another $475 million was spent on indirect costs from lost productivity due to diabetes. So if you look at that whole thing, guys, we have a big problem to unpack here in the state. It's nothing we're going to be able to achieve here in one day by any means, but it's something that we can continue to bring awareness to. If you have diabetes, Make sure you're adherent with your medications, guys. If you have issues with your medications or barriers to anything, right? Taking your medication, getting it paid for, whatever that may be, please work with your pharmacy teams. I really highly encourage and advocate for that. I mean, if you shoot me a message, of course, I will try to get back with you as relevantly and as quickly as I possibly can. Guys, I want to make sure that, we have everybody dialed in. It's just the way it has to be. But sharing knowledge, health is wealth. Let's do it, guys. You save $2 billion by being a little bit healthier. Where can we be better systemically? Where can we be the positive, helper T cells there to really cure the epidemic of type 2 diabetes throughout our state, throughout our country, throughout our world. So let's move on. Jumping into just an interesting story here, guys. From Texas A&M, heavy cannabis use by female adults associated with lower incidence of diabetes. And you're going to see multiple different studies. And, I picked this one because it obviously is an interesting eye popper. And at the same time, I do like the fact that we do see some perhaps positive correlations here. So whether or not they're statistically significant, is up for debate, but cannabis does not have, as a whole, enough statistically significant research for us to make big moves on and big decisions on as a healthcare system because of its federal status, of course. But looking at this was from last year in February, guys. New study recently published in Cannabis and Cannabinoid Research found women who heavily used cannabis had lower incidence of diabetes, a chronic condition that prevents, obviously, body from making enough insulin to be able to use insulin efficiently, right? So again, 1 in 10 Americans has it. The study here at Texas A&M was really examining just females, granted, white, non-Hispanic, over 40, and had at least college level education, but it was a survey from approximately 15,000 people. Cannabis use was estimated on the basis of exposure and frequency of use, with smoking cannabis fewer than 4 times per month deemed light, and heavy use defined as 4 or more times per month. So again, that's where they drew their boundaries. So looking here, diabetes status was determined by a physician diagnosis or meeting criteria for plasma glucose, fasting blood glucose, or hemoglobin A1C. So granted, people can look at the deep down in these numbers, but it does continue to, and I had an old philosophy teacher that said, the term beg the question is actually wrong, but for what mainstream of us say, beg the question, basically that, cannabis use does have a lot of positive associations with diabetes, especially THCV, is showing like weight loss and positive correlations there with diabetes. So getting the right, perhaps phytocannabinoid worked in there, could still be part of the equation. But we don't have it all figured out, and just positive data has shown that, over time, really, and this is just another one of the studies, but cannabis users are less likely to have diabetes. So I'm not saying that as a blanket statement, guys, but it's just a trend I'm really noticing. I'm sure everybody knows somebody that uses cannabis that is like absolutely the worst diabetic in the world. So don't let them be the bad example here. But looking here in this study of 15,000 people, female participants who used cannabis heavily were less likely to be diagnosed with diabetes than female participants who did not use cannabis. Light cannabis use by female participation had no association with diabetes diagnosis. Researchers found no association in male participants between diabetes and any level of cannabis use. Previous research has shown that the endocannabinoid system, a series of neurotransmitters and receptors in the nervous system involved in numerous biological processes, has different effects depending on sex. Right, guys? So looking at all this, females here are showing the correlation, but there's other studies and data that have shown correlation of significantly, carrying less weight by being a cannabis user versus not. But again, depending on where you see studies taken or pulled from, it's always look good to see, is it a large amount of people? How did they do this? Is it just in one area, one type of socioeconomic, situation? And cannabis has been such reduced to that. You don't want to see studies that are really that. So, interestingly enough, a 40-year-old white woman and above is an interesting little place to look at, because you're not going to see, some of those other challenges. And that's not for me to try to stroke any sort of, societal issues there. It's just, you really try to look at some non-bias in some degrees, right? So anyways, let's move on. Not Men's Health Minute. We're looking at our community spotlight. I'm sharing about Project Power for those of you guys in our region. This is out of El Paso, Texas. Project Power, it's from, American Diabetes Association, and it's here, no shame, no blame, just aim. Project Power is here to help the whole family. It's a no-cost lifestyle change program. Project Power empowers adults and children to reduce their risk or manage and thrive with type 2 diabetes. So looking at this whole Project Power program, they actually have a station over there in El Paso, Texas. I'm going to pull up the video.
Project Power is an initiative of the American Diabetes Association, and our goal is to slow the trajectory of childhood obesity because it causes a lot of chronic diseases, including type 2 diabetes.
We understood that our age group, 5 to 12-year-olds, they're not the ones making the final decisions. They're not the ones making the family meals or making the menus. We had to incorporate the families. So we're really excited to incorporate this new program for the parents.
We're targeting families because if we can get the families healthy, we can get the communities healthy, we can get the world healthy.
So type 2 diabetes and obesity runs rampant in our communities of color: African American, Hispanic, Native Americans, Pacific Islanders, as well as Asian Americans. We want to make sure that this program is reaching our target audience.
So shame and stigma of diabetes, it is in the communities of colors, is people don't want to talk about it because they feel like they did something to bring on diabetes. So they take it on and they go silent. What we want to do is make them speak loud about it. They are able to talk with their friends and family about diabetes and not be silent.
What I love about Project Power is seeing the kids take this information to their parents and say, Mom, look what I've learned. Look what I have been taught with this program. There's something that I can do in my community.
The American Diabetes Association, we encourage individuals to take diabetes risk tests, which will give you information on how you're at risk for developing type 2 diabetes. And if you are at high risk or if you have prediabetes, Project Power is here for you as well.
So anyways, they've got a substation out of El Paso, and I think it's a cool project overall. I think it's something we're supporting and worth connecting with here. Something in New Mexico, for whatever reason, doesn't seem to be working, guys. So I'm not saying let's look at something a little different, but I'm just saying let's try to, let's not do what we've always done, because it must not be working. Anyways, last thing we'll jump into here today: sexual health. Men understanding diabetes impact on sexual health. Just another reason to go get checked and try to manage this, guys. Looking at intimacy and health going hand in hand, guys. Men, ED, low testosterone are definitely sex and diabetes complications. So again, it don't have to be something you have to suffer from. and you don't have to be ashamed to talk about it, but it's just something that you can take medication for, and simultaneously continue to try to offset as you lower your A1C, get your weight down, right? Start getting the testosterone back up, getting the blood flow going throughout the body, exercise, all the good things, guys. So where we, are not trying to necessarily sit here and say that we're going to fearmonger you and say you're going to get type 2 diabetes if you don't go to the doctor, and then you're not going to be able to have an erection and have sex or anything like that. I guess in the perfect storm, that's what's happening, but it's just all the more reason to really look at that all together, guys. Your endocrine system, head, shoulders, knees, and toes are all connected for a reason there. So, that decline can happen in any which way, and it's a good time to really look at how can you, double down on reversing that, because it's absolutely reversible for like 99% of people. And so with that, I will end my live stream today. Hope everybody has a fantastic rest of your day. Hope I provided some good value to you here. If you have any questions, launch them to me, shoot me a message. Otherwise, peace out. We'll